It is such a joy to see everybody here and have you all celebrate a really good day. I'm Ken Marshall. I'm Chief Operations Officer at UofL Health. I first joined the team here at UofL Hospital nearly 30 years ago as the region's only Level 1 trauma center. We were busy then. The need for our services has grown tremendously since then. I look forward to the day when we open this tower to serve even more patients. The day is coming soon. And with the first spaces ready for occupancy early next year, but today we celebrate a significant milestone as we top off this tower and do it in a way that ensures everyone has the opportunity to leave their mark, literally. Joining us today for this occasion are Governor Andy Beshear, behind me, Mayor Craig Greenberg, Tom Miller, who is UofL Health CEO, our UofL President and UofL Health Board Chair, Kim Schatzel, representing our Frankfurt delegation, Representative Nima Kulnari, and Metro Council President Marcus Winkler is with us here today. We also have Jeff Bumpus, who is Executive Vice President of Health Affairs for UofL and the Dean of the School of Medicine. Sherry Kretschmer, our Chief Nursing Officer at UofL Health, is here. Jason Smith, the CMO at UofL Health, is here. Jason Chesney, the Director and Chief Administrative Officer at Brown Cancer Center. Steve Amsler, who really helped build this thing, Senior Vice President of Operations overseeing the project, and Barry Nunn, CEO of CoSare for Kids. We also have several of our department chairs, and this will be their workspace in a year or so, representing the teams that will occupy this new tower. Sean Francis, who is OBGYN, Dr. Kelly McMasters in surgery, Dr. Joseph Niemat in neurosurgery, Jared Thomas in emergency medicine, and Adriana Pilati in neurology. And many members of our boards, our UofL Health Board, our University Medical Center Board, University of Louisville Physicians Board, and the Regional Cancer Center Corporation. But before we really get into this and into the remarks of the programs, I'd like to invite all of those who were named that are sitting behind me, along with representatives from JRA Architects and Weir Construction, to come to the place where the final signatures on this beam are going to be made. I also like to take some time to acknowledge some additional community supporters that are joining us here today. The Crusade for Kids, the Legacy Foundation of Kentuckiana, Game Changers, Hope Scarves, Gilda's Club, Republic Bank, and Fifth Third Bank. Thank you for our ongoing support of our mission here.
You know, this beam and the signatures that are on this beam represent the past, present, and future of healthcare in this community. This year, we marked the 200th anniversary of University Medical Center and the millions of patients that we've taken care of. If you can imagine 200 years of being here and the healthcare that's provided, it's a remarkable achievement. And these names represent that. The present, all the caregivers that are here who take care of patients every day. We had 70 patients who did not get a room last night in our hospitals. And our goal as this beam goes up, and it holds the weight of this community and the healthcare that's there, is that we'll be able to never say no to anybody in need. And that was our mission. That was our mission as we started. Every single day, if there is a need out there in the community, we will say, yes, we will take care of you. And I'm proud that we're an organization that means that when we say that. And whether it's trauma or stroke or burn care or any other type of care, we're here for the community. And that's why we built this, is to make sure two things happen. One is that every patient gets a private room within our hospitals. And secondly, that no one stays a night in the ER who could be in a room. And we believe that adding these 98 beds as we do this will achieve that. We also are adding additional operating rooms because we have so many people that are in need that we need to take care of it. That'll add 23 total operating rooms that we have. And we'll actually have a lobby within the hospital. If you've ever gone in, we actually don't have a lobby. But our focus as an academic healthcare community is to partner with the university, the medical school, and all of our team members that are here to do one thing, to improve the health of the community we serve. That is our mission every single day. I'm honored to be the CEO who helps to watch this happen, and I thank all of you for helping make and contribute this. And I'm going to turn this over to the president and the chairman of the board of our hospital, Dr. Kim Schatzel.
Good morning, everyone, and thank you for being here today. This is such a wonderful milestone for this game-changing project, a project that will dramatically impact the future of healthcare, not only in downtown Louisville, but for our entire community and our entire state. I want to echo Tom Miller's welcome and say thanks to Governor Beshear, Mayor Greenberg, Senator Neal, President Stivers, and Speaker Osborne, and all of our elected officials in Louisville and Frankfort for their ongoing support of the University of Louisville and UofL Health. Without their backing, without their guidance, without their support, projects like this, well, they would just never, ever happen. I would also like to thank Tom and his tremendous team for what they have done to grow and strengthen UofL Health into a preeminent healthcare provider for our region and the Commonwealth. It is absolutely a job that's been very well done. Yes, round of applause, thank you. As I've said, this project is a game changer for our community. Yes, expanding UofL Hospital will help us meet today's medical needs, but this is also an investment in tomorrow and the future of Louisville and the future of Kentucky. This investment will help us grow the number of physicians, nurses, and other allied health professionals who are so badly needed to fill the shortages that we have. For both UofL Health and UofL, this project is mission critical. Not only will this expansion increase the hospital's operating capacity, modernize the facility and create downtown jobs, it will also allow greater opportunities for healing, for teaching, and for research, while all building a stronger healthcare workforce and guaranteeing a healthier future for all of Kentucky's citizens. I can tell you the fact that cranes warm the hearts of a university president. I also think a hospital CEO, a mayor of Louisville, as well as a governor, because they are signals of progress, and cranes are signals of a very bright future for UofL Health, the city of Louisville, and Kentucky. This UofL Health project also meshes nicely with the university's plans for $280 million simulation center and collaboration hub that will soon go into construction just a block away at Chestnut and Preston. This center will house our 4 health sciences schools and will dramatically increase our university's ability and our nursing school's ability to create new graduates. As we all know, our state faces a huge shortage of nurses. Nearly 6,000 spots are unfilled, and this simulation center is going to be critical to us answering that shortage. This center is the largest single capital project for the state university in its current budget, and it is the largest appropriation approved by the state for University of Louisville in its history. And I can't thank the governor and the legislator and the leaders for that support. It truly has been remarkable. Thank you, everyone. The growth in the Health Sciences Center is obviously good news for UofL and our city's downtown core, but as I said, it needs much more than that. These kind of collaborative projects between Louisville, UofL, UofL Health, and Kentucky, they're game changers for us, for the entire state and for the region, and they will improve the well-being of our community for generations to come. That truly means much to our community and means much to the University of Louisville and UofL Health. So thank you again, and with that, it is my pleasure to bring to the podium the Governor of Kentucky, Andy Beshear.
Thank you all, and good morning, everybody. It is a great day to be in Louisville to celebrate the topping off of this incredible facility, this incredible addition to UofL Health's UofL Hospital. About 2.5 years ago, we came together to announce the expansion and this investment. And I admit a lot's gone on in the last 2.5 years. A lot's even gone on for me in the last 2.5 months. But I'm right where I'm supposed to be with all of us together celebrating this incredible investment. Now, we are here again to celebrate the growth and progress happening today. Today is a day that so many people at UofL Health worked so hard to make possible. So thank you to each of you. As governor, I believe that quality, accessible health care is a basic human right that is deserved by all of our people. And UofL Health and this investment, the state, the executive branch, the legislative branch, everybody is coming together to make that a reality. This expansion is great news for our entire Commonwealth because UofL Health doesn't just serve the people of Louisville. It serves patients from all 120 Kentucky counties. And now, they'll be able to serve even more of our people during their greatest moments of need. And that's important because if there's one thing the heroes at UofL Health have shown, it's that they will be there in our time of need. I saw that first during the pandemic, the most difficult, probably the most terrifying time of most of our lives. I saw some of the most heroic actions by our healthcare heroes walking into COVID wings when we did not have the proper PPE to protect them, showing up every single day, not just risking their own health, but possibly bringing a dangerous virus home to their families. But because you and so many others showed up every single day in our most difficult time of need, there are thousands of Kentuckians still alive today. Let's thank them for that incredible work. I remember U of L's work setting up one of the largest drive-through testing sites when Kentucky created the model for the rest of the country. I remember when the UPS truck rolled up what were supposed to be the first vaccines to Kentucky, and we realized it was the wrong UPS truck. But I remember the right one coming. Right after that, that sense of hope and joy and not frustration, but that excitement, and then watching Jason Smith back here and many others roll up their sleeves knowing that we had taken a massive step in moving through that pandemic. And then I saw your incredible work and your empathy again in April of last year after the senseless shootings at Old National Bank, and I know many others that occurred that year and sadly occur every year. But I remember on that day I had a friend that didn't make it here, but I had a couple that did. And I got to see them and the incredible care you were giving. And for that, it'll always be hard to pull up to this block, but I'll always be grateful for your work. That day I saw our healthcare heroes stepping up in unthinkable circumstances, saving lives and being there not only as doctors, as nurses, as surgeons, but as I saw as compassionate people that day would even give a hug to a governor that really needed one. The beam that we just signed is a symbol of U of L's continued compassion of providing quality health care for Louisville and for all of Kentucky. In addition to creating space for patients, this project is a massive economic development project for the Commonwealth of Kentucky. Folks, this is more than a $144 million investment in this city, and it's creating 325 good new jobs. And U of L continues to not only invest in this community, but in communities around our state. In March of this year, we celebrated the opening of U of L Health South Campus in Bullitt County. That was a $78 million investment in that community, filling a gap, ensuring that no one ever has to drive that far, an ambulance never has to come that far, and again, living up to the promise of being there for our people, helping more people, and saving more lives. At the South Campus and here at this location, Kentucky and Indiana families too will know they'll be able to get the best care from our most trusted professionals. And as we close out today, I'm just excited. First, I'm excited to continue to be your governor for the next 3.5 years. I think about how far we've come to provide opportunities to our kids and to our families. I first think about our red hot economy. This is just one project that together has equaled over 1,000 announcements. $32 billion of new private sector investment, a record for any governor by far. 55,000 new jobs. The best 2-year average for wages. Breaking every record for exports, for tourism. Having the lowest 3-year recidivism rate we've ever seen. And thanks to so many people here and working across Kentucky, we're one of the only states that's seen our drug overdose deaths go down 2 years in a row. Thank you for that work. We're being recognized nationally. Last year, Site Selection Magazine ranked us number 3 in per capita economic development in the country. Number 2 the year before. Suddenly, we are a destination, never to be a flyover state ever again, but where people, where companies, and where families want to be. But we cannot achieve that level of opportunity for every Kentucky family, leaving none behind, if we don't start them healthy and keep them healthy. One of the most important aspects of achieving that Kentucky we've all dreamed of building our new Kentucky home, is to make sure that no Kentuckian has to drive 2 hours or take 2 buses to see their doctor. So I am really proud of what this community has done, how many of our groups have come together and said, we will fill the holes in this city and in this state. Folks, this is our chance. This is our opportunity. A period of growth in so many areas where we can be the difference and the change that lasts the next several decades. So let me thank you. Let me thank you for your work on the toughest of days. Let me thank you for your work on each and every day. And I can't wait until some of our healthcare providers have the newest, most state-of-the-art facility to provide the very best care. To our healthcare heroes, we love you. We care about you. As long as I'm governor, I will stand up and fight with you every single day. God bless y'all. And now I get to turn it over to a partner in governing, a great mayor, one who has brought a level of energy, is bringing unparalleled investment through our state budget, who has been up in Frankfort advocating for this city each and every day. A friend of mine for the past 20 years. Really excited we get to govern together. And just wait, there's a lot more good news to come, especially from your mayor, Craig Greenberg.
Thanks, Governor. That's all right. Thank you so much, Governor Beshear. Good morning, everyone. As President Satchel said, mayors, governors, university presidents, we love cranes, we love beam ceremonies, we love new buildings that are signs of progress that are happening for our institutions, for our cities, and our states. And that's just one of the many reasons why today is so great. And so just briefly, I want to give a few thanks. I want to start by thanking every member of the UofL and UofL healthcare team. To President Schatzel, to Tom Miller, to Ken, to the entire team of healthcare heroes. You heard from the governor about the amazing work that they do every day. And that is just going to continue and grow with new buildings like we're here to celebrate the construction of today, focusing on the physical health and also the mental health of everyone in Louisville and our surrounding region and state. We would not be the strong city we are without the leadership of UofL Health in our community. So thank you all so much. And I also want to thank, the governor and other leaders from Frankfort, Senator Stivers, Speaker Osborne, Senator Neal, and others who are here with us today. Thank them for their continued investment in our city. We are getting ready to undergo an amazing transformation of our city, in large part because of the investment that our state is making in the entire city of Louisville. Just recently, the General Assembly passed and the governor signed legislation that is investing $1 billion in the coming years in our city. And a big chunk of that is going right here to the University of Louisville, as President Schatzel talked about, right here to the University of Louisville in the Lou Med District. We are sitting in the center of the Lou Med District here, a district that we want to be the world's leading campus for medical education, research, and more. And with the state's partnership and the city's support as well with our friends on Metro Council, we are getting ready to make that happen. Work is already starting on improving the infrastructure around these important buildings like we're celebrating today, so that LouMed is a place where everyone wants to work, everyone feels comfortable coming to as a patient, and people want to live here as well. It is an economic driver, it is a healthcare driver for our city, but also for our entire state. And that's why I'm so thankful for the state's continued investment. So with that, let me introduce one of these great partners who's representing our city in the General Assembly. My good friend for many years, someone who represents his district well, but also our entire city on so many issues: healthcare, economic development, issues of equity, affordable housing, and so much more. Ladies and gentlemen, please join me in welcoming Senator Gerald Neal.
Good morning, everyone. What I appreciate about the mayor is that he said that just like I wrote it down. So I'm feeling good. And the other point is I'm putting my seersucker suit on, especially for this occasion. This is the last chance I'm going to get for the season. So that exemplifies how important I feel this is about. You know, the words have been spoken here. I can't add a lot to that. We all know that this is a symbol of our growth and development. This expansion here is important to us all. But I want to put a little personal note to it. You know, my sister was a 40-year registered nurse, and half of it was here in Louisville, Kentucky. But I did not know what that meant. I really did not know what that meant until I was struck with COVID back in 2020. And folks didn't know exactly how to handle that. And I went into the hospital, and it was those doctors, and I got to say, those nurses who wrapped their arms around me, and even in the moments of what should have been my greatest fear, they brought their professionalism, their love and care to me. It took me to another level. And if you really think about it, that's what this is really all about. It's about expanding the capacity of those who are trained to do the best in our community to do that work. And that's what's important. And yes, the governor, I was glad to hear the governor. It's the first time I heard him actually say that. He's going to be here another 3.5 years. I like that. Give him applause. Come on. So let me say this. This is important. It's important because it's personal, as I've indicated to you. It's important because it has economic implications that project us. It's important because it's also a symbol of our growth and development as we go forward. It's important because every time we do this, every time we do something like this, every time UofL Health and those who collaborate with them do this type of thing, it brings us together as a community, give us hope about what we can do, and it inspires us to do even better. So God bless all of those who are involved in this. God bless the leaders that I have the joy of working with from day to day. And God bless you all for coming and supporting this effort. God bless.
Hi, I'm Sherry Kretschmer. I am the Senior Vice President and Chief Nursing Officer for UofL Health. And as UofL Health nurses, physicians, and healthcare workers, our promise to this community is always to deliver compassionate, innovative, and patient-centered care. And the new tower will help us do exactly that. Hoisting this beam today, signed by those here at UofL Hospital, will demonstrate our commitment to this community and the region and solidify that promise. The nursing team at UofL Hospital is nationally recognized as a magnet facility, and this is the gold standard of excellence for nursing across the country. Even though we have achieved those high marks, we will still continue to work to improve and make it better for our patients every day. When the tower is completed, I believe that this building will represent the high quality nursing care that is delivered here each and every day. The additional beds and space will allow us to reconfigure the way we deliver care. Today, because the expertise of UofL Hospital is in such high demand, patients are often placed in the first appropriate bed that becomes available. But this tower will give us new beds and new space and allow us to better place our patients with similar needs in similar areas. That ultimately means better care for our patients because our specialty nurses will now be matched with their expertise and their skill sets. In addition to enhancing the specialized care, this new environment will allow our families to be a greater part of their loved one's healing journey. The tower will also bring 325 additional jobs. The excitement has already started in our community, and this is evidenced through our partnership with the U of L School of Nursing, in which U of L Health was able to hire 65% of all of the new grads across the city. 80, of those 149 new graduate nurses, 87 has chose U of L Hospital to come to work in. They've chosen our facility because of our specialty care, our critical care, our trauma and burn programs, our neonatal ICU, and our stroke care. The patient is just one part of the redevelopment of this area, as we're excited with the partnership with U of L Health, with their U of L's new health science simulation lab and collaboration hub. With that opening just a block away, it will put our nursing team in a much better position to keep advancing their skills to ensure that our patients get the best care every day. So with that, this has been 200 years in the making, and now we're proud to be part of U of L Hospital today, and we look forward to what our future will hold. Thank you.
So thanks, Sherry. I think we're going to have a little countdown here, but I look around this crowd and I see the blue scrubs, which represent our nursing staff. I see the white coats, which represent our physician staff, and I see those who are ancillary staff that also take care of our patients. I can't let this day go by without all of us just stopping, giving a round of applause to all of those who do that. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Lift away.